In this section, we are going to study about the epidemiology of Barrett's esophagus. What are the epidemiological factors that affect Barrett's esophagus, and what are the cancer-related risks with esophagus? In this section, we'll be studying about the epidemiological factors and then the cancer-related risks. What are the risks that occur with esophageal cancer due to Barrett's esophagus? And what is the link between Barrett's esophagus and H. pylori bacter infection? Barrett's esophagus is usually diagnosed by chance during the evaluation, then during the endoscopic evaluation for the gastroesophageal reflux disease. This occurs just by chance when a patient comes to the gastroenterologist for the evaluation of gastroesophageal reflux disease, and then when the patient is being investigated by the endoscopy, the endoscopist finally realizes that the patient also has Barrett's esophagus. So the epidemiological factors. The average age of a patient who are being diagnosed with esophagus is around 55 years, and it's very rare in patients under than 10 years. People that are more predominant are the white men, and it is very uncommon in patients who are in the Asian countries and who are black. Obesity with central adiposity. Patients who are obese and who have a very central adiposity predisposes to Barrett's esophagus. And this prevalence is much more higher in Western population, which is between 1.6 to 6.8%. If we talk about the risk of cancer, how can a patient with Barrett's esophagus be predisposed to esophageal cancer? Cancer risk for patients with non-dysplastic Barrett's esophagus is around 0.12% to 0.33% per year. The incidence of adenocarcinoma in patients with Barrett's esophagus is usually increased due to the intake of dietary nitrate in green leafy vegetables. This is usually resulted due to the widespread use of nitrogen-containing fertilizers, which are being used by farmers these days. This causes a higher risk of adenocarcinoma within the individuals of Barrett's esophagus. If you see in this graph, we can see that on one side we'll see the annual risk of esophageal adenocarcinoma per 100 patients with Barrett's esophagus. And if we see the Barrett's esophagus without dysplasia, like I've mentioned before, is around 1.2 to 0.3%, and it's relatively low as compared to Barrett's esophagus with low-grade dysplasia. Their patients were divided into low-grade dysplasia and high-grade dysplasia. The patients with low-grade dysplasia are around 1% per 100 patients per year. And the patients with Barrett's esophagus with high-grade dysplasia are the most common ones, and they have the most highest risk of developing adenocarcinoma of the esophagus, which is around 6% per 100 people. There are almost around 60 people in a population of 100 people who definitely develop the esophageal cancer due to Barrett's esophagus with high-grade dysplasia. H. pylori infection, which is called as Helicobacter pylori infection. You'd be thinking that H. pylori infection would definitely have a negative effect on Barrett's esophagus. For example, Barrett's esophagus could be because of this infection, but you're completely wrong. H. pylori infection has a very positive effect in preventing any sort of Barrett's esophagus. How is that possible? H. pylori infection protects against the development and the neoplastic progression of a Barrett's esophagus. You'd be wondering, how is that possible? This occurs because H. pylori ultimately prevents any sort of gastroesophageal reflux disease by decreasing the gastric acid secretion. So in other words, you could say that when there's a decrease in the gastric acid secretion, gastroesophageal reflux disease wouldn't occur, and if gastroesophageal reflux disease wouldn't occur, Barrett's esophagus ultimately wouldn't occur because it's a complication of gastroesophageal reflux disease. So in the Western population, the declining frequency of this H. pylori infection gives rise to a more frequent esophageal adenocarcinoma. This ultimately occurs mostly in the Western population because H. pylori infection is the frequency of H. pylori infection is very low in this population, and ultimately they're more prone to producing Barrett's esophagus. So in this section, we have studied about the epidemiological factors. What are the factors related to the age, related to obesity, related to the white and black population? And then we have studied about the cancerous risks, the risk of cancer in low-grade dysplasia and the risk of cancer in high-grade dysplasia. And ultimately, we have studied about the Barrett's esophagus, which causes H. pylori infection. H. pylori infection has a very vital role in preventing Barrett's esophagus. That's all from this section. Thank you for watching sqadia.com.